which had a very big sample size, and then from 8.1% median down to 7.5% median in the standard group. And intensive group, both of them use medications to drop. It's just that one uses more intense forms of medication. They take them more frequently. And so anyway, both groups had a much greater decrease than we ever saw in exercise in a 4-month period. Like that's a very big decrease. So there's really no question of whether medication decreases your hemoglobin A1c levels or not. But this study was also discontinued at 3.5 years because the intensive therapy group had significantly higher death rates than the standard group. 1.41 deaths per year compared to 1.14 deaths per year. And the reason behind this, we're not 100% sure, but we hypothesize that it's for 2 reasons. There are many risk factors that are affected by diabetes. Hemoglobin A1c isn't the only risk factor. There's also LDL, there's HDL, there's blood pressure, there's triglycerides, there's BMI. There are a lot of risk factors that go into, that are affected by diabetes, and medication for hemoglobin A1c only affects that one. And so yeah, you may decrease your hemoglobin levels, but the other things aren't going to be affected or lowered or improved unless you also take medication for them. And then also because with the hemoglobin A1c lowering medications, there were also more hypoglycemic complications, which means there were more patients that had blood sugar that was too low, and that also causes complications. So those were the 2 reasons that we thought maybe there was a higher death rate in the patients that were on the intensive medication therapy. And so yes, medication can lower your hemoglobin levels very rapidly, but there may be a risk of death. So,
going along with that, just real quick, this chart right here just illustrates one of the medications that we found and studied. Is a cinnamon capsule that helped lower hemoglobin A1c. But as David was explaining, there are better alternatives than the medication because there were problems that we viewed in the other studies. Just a few of the other studies that we did, a few other studies we went over, like the church study and the Casadena study, also added the portion to where the participants who were able to lower their medications. So just for the church study, those who were participating in the resistance group, 26% of them were able to lower the amount of medication they were taking. The aerobic group was 29, the combination group was 41, and then the control group 22, based on just other factors. For the Casadena study, the resistance group, this is the one with the diet, right?
This is the one, no, this isn't.
This is not that one?
No.
Oh, my bad, okay.
No
Anyway.
problem.
This one, anyway, the resistance group was able to lower, 72% of them were able to lower their medication intake, while the control group actually had to increase the amount of medication they were taking. So this slide is just demonstrating that exercise can help you to wean yourself away from the medication, because ideally you don't want to have your health sustained through medication.
Going along with talking about medication and exercise, I think we can come to a valid conclusion that exercise overall, for everything that we've talked about with all the diseases and all the presentations, is the most beneficial for us. Although medication can help, if you can get yourself to exercise more often, you're going to wean yourself away from those medications and get better health along with diabetes, but also a better lifestyle in general, dealing with LDLs, HDLs, and everything we've discussed. This first slide is the first overview of our guidelines. I just wanted to point out that with being greater than 7.5, we would recommend any of these exercises, as they would all lower your HbA1c levels. Starting with resistance, if you do resistance, as we said before, 2 to 3 times a week, performing 3 sets of 7 to 9 exercises, and the exercises that should have been on the other slide that are right here that we said, is exercises that involve major muscle groups, that work your major muscle groups. So just a few examples, we've got leg press, curl-ups, push-ups, bench press, and basically, like I said, any exercise that focuses on those major muscle groups would be considered resistance. And we recommend doing that at 70 to 85% of your 1 rep max. Going on to aerobic, doing that 3 times a week at 75% of your VO2 max for 40 minutes. And just like Kyle was saying earlier, we recommend not allowing a 2-day spread between those exercises, as that allows for that insulin sensitivity to kind of go away. So as you continue to exercise and not allow too much time, you'll get the greatest benefits. And so we recommend that 50% of your VO2 max for about 30 minutes each day. And then finally, as you can see in the note down here, we recommend these over 7.5%, but the most that we strongly recommend is doing the combination of resistance and aerobic together, which would mean doing resistance and then on the alternate days doing aerobic training. We know from the studies that we've seen, and like it says down here, the longest period that we saw was up to 9 months. So at least up to 9 months, we know that if you do a combination of aerobic and resistance training, you're going to get the greatest benefits and greatest decreases in those HbA1c levels. So for this overview, that's what our strongest recommendation would be.
Continuing with our overview, the graphs that we made earlier, we thought it was pretty cool. We were able to derive equations from those that could help somebody get an estimate of how much their hemoglobin levels would decrease if they had a certain baseline HbA1c based on which exercise program they chose, and how long they wanted to do it. We put 6 months here. So if somebody wanted to do a combined exercise program for 6 months, using this equation, which we got from the graphs that you saw earlier in this presentation, if they had a baseline of 8%, we could expect on average for them to see about a negative 1.17% decrease. At 7% baseline hemoglobin A1c levels, a 0.66% decrease, and then to a 6%, a 0.16% decrease. As you see, we have that for both aerobic and resistance as well. Once again, combined is much greater. And once you get down to the 7% range for aerobic and resistance, you start seeing very minimal decreases. And down at the 6% level, there is no significant decrease expected at those levels. And so I think that's all I have to say about that one.
All right, just real quick to add on to the recommendations. A yoga recommendation for those who have a hemoglobin A1c count over 7.5%. Just like was mentioned earlier, an hour a day, 3 days a week. It's important if if you know someone who's like obese or elderly or kind of lives a more sedentary lifestyle, these new types of exercises are really good for lowering hemoglobin A1c. Is what we viewed, kind of like with the combination group, is like introducing your body to like new types of new ways to work, and muscle utilization really did help lower hemoglobin A1c. Just like pretty generic recommendations, creating workout groups to keep it going, staying active and making goals as far as losing weight and controlling your diet.
And for the walking recommendations, like we said, just to recap, brisk walk 3 to 5 times per week, 50 to 60 minutes at self-regulated brisk pace, but building up to 65 to 75% heart rate max. And like we said, studies show that a 0.5 drop can be expected after 6 months in patients with a baseline level from 7.5 to 7.7%. And comparing Walker to Sons and Associates show that walking 5 times per week delivers faster reduction than 3 times per week. And going along with the psychological effects, we could highly encourage walking as a group, like a workout group, or just doing some walking as a group, and then you see better results.
And that's it.